Hey everyone, YouTube's DOT physical expert Dr. Nuesse back again with another video, and this one is on pre-employment marijuana screening, drug screening. So we're talking about marijuana specifically, we're not talking about any other drugs. So I've done drug testing videos in the past, I've done other videos on different drugs and what we were looking for in the procedures. I will leave a link to one of those videos up here, but this one is going to be marijuana specific. So drug screening, pre-employment drug screening as it pertains to marijuana. Now I'm doing this video specific on marijuana for two reasons really. Number one is generally marijuana is the most common drug that people are going to be concerned about when they go in to take a drug test, to be honest. And number two is marijuana is becoming more and more accepted, especially in the United States. A lot of states have completely legalized the use of marijuana, so there's a lot of misconceptions. Are we going to be testing for it? Are we not? I want to clear all of that up. All right, so in this video, we're going to be talking about the two main types of tests that can detect marijuana in a person's system, the two most common types of tests, those being a urinalysis, a urine sample, or a hair follicle test, a hair sample. And we're going to be talking about how long can we detect marijuana in your system after you stopped using, the acceptable levels, how the test is administered, and we're also going to talk about different ways that people try to get around the test, synthetic urine or different types of shampoos, those types of things, and do they actually work? All right, so the first thing that I have to mention is that there is no federal exemption. Marijuana is still considered an illegal drug by the federal government. So if you are being tested, even in a state where marijuana is completely legal, or you can have a prescription to use marijuana, if you're being drug tested, you're going to be tested for marijuana, and if you test positive, that could put your potential employment in jeopardy. So just know that even if you're in a state where marijuana is completely 100% legal, you're still going to be drug tested for marijuana, and if you test positive, again, that could put your employment in jeopardy. Now, there is certainly potential for this to change. As of posting the video, that is the current standard, but this could change in a year, in 2 years. We just don't know. Again, marijuana is becoming more and more accepted, so please stay subscribed to this channel, because if that change does occur, I am going to make an update video so that you are aware of it. And also, if you have any additional questions, you can connect with me directly. I'm going to leave a link on how to do that in the description box as well. All right, let's move on and we'll talk about the most common way to detect marijuana in a person's system, and that is through a urine test. All right, so the urinalysis is basically the gold standard. It's what you're going to encounter most commonly when going to get a drug test done. It is what the government uses for drug tests. They use urinalysis for police officers, pre-employment screening, CDL drivers, pilots. You know, basically across the board, the government is going to use urinalysis, and most private employers are as well. Now, some are going to request hair follicle samples, and that may be getting more and more common, but as of, again, the posting of this video, and I will make an update video if it switches to hair samples, but as of the posting of this video, urinalysis is still the gold standard, so let's spend some time talking about the urine test. All right, and first things first is how long after you stop using marijuana will it still be detectable in your system? So in general, and I've got to preface this by saying in general, because it does depend a little bit on how heavy of a user you were and how long you used marijuana, and a little bit on your size and if you've got any kidney or liver disease. So there are some other factors at play, but in general, if you stop using marijuana 30 days before the test, you will, again, in general, test clean. So you want to at least give it 30 days before you are drug tested. So it typically will stay in your system for 30 days. All right, and next, what levels are we looking for? What is going to cause a positive test? So the testing for marijuana is very, very specific. We're looking for 50 nanograms per milliliter on the initial sample. So if you test positive over 50 nanograms per milliliter. Then they're going to do a confirmatory test, and that is 15 nanograms per milliliter. So really, you want to be able to pass that first initial test, and that's 50 nanograms per milliliter. Now, certainly you can get home tests and check to see if you are above this level, and I'll actually leave a link to one of those tests in the description box as well. So certainly you can use a home test maybe to get an idea, but again, I would not rely on that 100%, but those are the levels we're looking for. 50 nanograms per milliliter initially, and then if that one comes back positive, we're going to confirm that with a test that can test 15 nanograms per milliliter. All right, and now let's talk about, can you do things like use synthetic urine to actually beat the marijuana drug test? And I'm going to actually show you a study here. So there was a study done, and unfortunately, I guess for providers and for employers, is that this study showed that the synthetic urine that was used by the participants that used synthetic urine, one, tested negative, and two, could not be detected as synthetic urine. So what this study suggested, because they also put this in place as well, is that direct observation was the best way to make sure that somebody was not cheating on their drug test. So basically what I am saying here is that synthetic urine looks like it probably would work, and that's why people will often be observing you when you are giving your sample. Now, whether you think that is an ethical thing for people to be able to do or it violates privacy rights and things like that, that is a whole nother can of worms. I'm not going to go into all of that. But that's just kind of the way it is. So this study basically confirmed that direct observation is the best way to make sure that somebody is not cheating on their urinalysis test. Now, some places do that, some do not. But synthetic urine, as far as this study goes, does seem to work as far as not being detected as synthetic urine and causing a negative result. All right, and finally, as it pertains to the urinalysis, let's talk about secondhand smoke, because I've had this come up in my offices as well, is people will say, well, I don't use, but my roommate does, so am I at risk for not passing? I'm going to again show you another study, and this one basically showed that unless you are right near a person, right next to a person in a closed room with no ventilation for a very, very long time while they are using, basically secondhand smoke will not cause you to test positive unless you're right next to them for a very long time in a closed room, which basically is not going to happen. Secondhand smoke will not cause you to test positive or not cause you to be over that 50 nanograms per milliliter level. So this study again showed that secondhand smoke really will not cause a positive result. Okay, so let's move on and we'll talk about hair follicle testing, hair testing. This is becoming more common. More private employers are requesting to have this exam done. Again, the government still uses urinalysis testing as of the posting of this video. Again, that may change. If it does, I will make an update video. Again, please stay subscribed. I want you guys to stay informed. So hair follicle testing is becoming more common because you can test for lower levels, and I'm going to talk about that here in a second. You can test for a longer period of time, and it's virtually impossible to cheat this test. And again, we'll talk about that here in a second as well. All right, so again, first let's talk about how long is this going to be detectable in your system after you stop using marijuana. So for hair, it is different. So for a hair sample, it's going to be detectable in your system for up to 3 months. So you're going to want to stop using before having a hair test for at least 3 months. So 3 times as long as the urinalysis. And again, this is going to vary a little bit, again, based on size, based on kidney and liver function, how long and how heavy of a user you were, etc., etc. So there's a little wiggle room here, but in general, it's about 3 months. All right, and next let's talk about what levels are we looking for? What levels, what concentrations are going to cause you to test positive? And this is a much more sensitive test, so the levels are much lower. So the levels on the initial test for a hair sample are 1 picogram per milligram, and for the confirmation test, it's 0.1 picogram per milligram. So really you want to be under that 1 picogram per milligram, and that is a much more sensitive test than the urinalysis. Again, another reason why a lot of employers are switching towards hair follicle testing. All right, and next let's talk about ways that people try to get around this test or beat the test even if they've used marijuana in that 3-month window. And one of the most common ways is with special shampoos. You'll see these all over the internet, shampoos that promise that if you use them, they will strip out the THC metabolites from your hair, and then you can go in even if you've used marijuana very close to the test and still test negative. I have to be honest with you and tell you that I've never read any scientific research that that is actually the case. So the claims that these shampoo companies or these different companies make, I can't validate them as credible through a scientific source. So I would say that these are probably not true or not good ways to, again, circumvent the test or get around the test if you've used marijuana in that window. So I wouldn't put any stake in the fact that you're going to pass the test by using any of these special products or these special shampoos if you've used marijuana within 3 months of the test. All right, so a special note here about the hair testing is, what about bald people? What about people that just don't have any hair? They've shaved their head or they've went bald? Well, in that case, we are going to then use body hair, hair off of your arm, hair off of your chest. Now, some people have no hair on their body whatsoever, and in those cases, we cannot perform this test. Now, to be honest with you, I don't know what the consequence of that is. I've never heard of a situation where that's actually happened. Maybe then you do have a urinalysis, or maybe then your employer just cannot hire you because you cannot complete the test. So I'm not exactly sure what the consequence would be in that particular case. It would be on a case-by-case basis. All right, and that's it. That's everything there is to know about pre-employment marijuana testing. I hope that cleared up some of the misconception and gives you a very good idea of what to expect when you go in to be drug tested before getting a new job. All right, everybody, until next time, stay safe.